Assalamu alaikum. Today we will discuss about respiratory viruses. Most of the respiratory viruses are RNA virus except one DNA virus. The DNA virus is double-stranded and that is adenovirus. Rest of the other respiratory viruses are RNA virus. The respiratory viruses are maximum of them are enveloped, only two are exceptional that are non-enveloped. The non-enveloped respiratory virus include rhinovirus and adenovirus, and the enveloped respiratory virus include orthomyxovirus, paramyxovirus and coronavirus. All the enveloped viruses have helical symmetry and the non-enveloped viruses have icosahedral symmetry. The icosahedral symmetry non-enveloped rhinovirus consists picornavirus, and its RNA is positive polarity, and the only adenovirus, which is the DNA virus, consists adenovirus. Under the enveloped RNA virus with helical symmetry, there are three groups. These are orthomyxovirus, paramyxovirus, coronavirus. The myxo refers to mucin, that is surface glycoprotein. Orthomyxovirus includes only one virus family, that is influenza virus. Under paramyxovirus, there are parainfluenza virus, respiratory syncytial virus, and human metapneumovirus. Under coronavirus, as you all know, there is coronavirus. There are some difference between the orthomyxovirus and paramyxovirus family. The orthomyxovirus family have segmented single-stranded RNA genome of negative polarity, and paramyxovirus family have non-segmented single-stranded RNA of negative polarity. Orthomyxovirus does not have fusion protein, but paramyxovirus have fusion protein. As paramyxovirus have fusion protein, so the cells fuse and form giant cell. But in orthomyxovirus, as there is no fusion protein, so there is no formation of giant cell. In the envelope of orthomyxovirus, there are two proteins which are known as hemagglutinin and neuraminidase. These hemagglutinin and neuraminidase are on different glycoprotein spikes. As you can see in the figure that there is one spike containing hemagglutinin, another spike neuraminidase, another spike hemagglutinin, another spike neuraminidase. But in case of paramyxovirus, these hemagglutinin and neuraminidase are on the same glycoprotein spike. This is another difference between orthomyxovirus and paramyxovirus. The coronavirus family have positive stranded, non-segmented, single-stranded RNA. And coronavirus get their envelope from the endoplasmic reticulum of the host cell. Rest of the respiratory enveloped virus get their envelope from the cell membrane of the host cell. So only orthomyxo and paramyxo virus have negative polarity RNA, and coronavirus and rhinovirus have positive polarity RNA, and the only DNA virus is adenovirus. Now we will discuss about the orthomyxovirus. I have already told you that orthomyxovirus contains only one virus family, and that is the influenza virus. Influenza virus causes pandemic. Now we will discuss about the structure of this virus. The virus have segmented single-stranded RNA genome of negative polarity. It has helical nucleocapsid and an lipoprotein envelope. The lipoprotein envelope contains glycoprotein spikes. One glycoprotein spike is One glycoprotein spike contains hemagglutinin and another glycoprotein spike contains neuraminidase. The influenza virus are three types: A, B and C. Type A influenza virus is the cause of pandemic, that is worldwide infection we are seeing in case of coronavirus, the pandemic infection. The B, new influenza virus type B, causes major outbreaks, but it does not cause pandemic. Type C causes mild respiratory tract infection but no outbreaks. Type A causes influenza flu-like symptom both in human and animals, but type B causes disease only in human. These three group A, B, and C. There are also antigenic type that depending on the hemagglutinin and neuraminidase proteins on the glycoproteins on the envelope. Due to there are hemagglutinin are of 16 types and neuraminidase are of 9 types, and according to their recombination there are influenza virus A can be classified into H1N1, which in 2009 derived from swine origin influenza virus, H3N2 which caused pandemic in 1968, H5N1 which is also known as avian flu or bird flu, H7N9 it is also discovered in the forest birds, and H2N2 1957 it caused the pandemic. The genome is negative polarity, therefore the virus contains RNA polymerase enzyme, that is RNA dependent RNA polymerase, for the transcription of positive strand RNA, as positive strand RNA is the mRNA for the translation of protein. Now, hemagglutinin has 16 types, and one type 1 to 3 are important for human disease. It has three functions. It binds with the receptor on the host cell surface, that is neuraminic acid receptor and sialic acid receptor. The hemagglutinin is also important for laboratory diagnosis as it agglutinates red blood cell, so it can be diagnosed by hemagglutination inhibition test. And the most important thing is that hemagglutinin produces neutralizing antibody in our body. So the neutralizing antibody will neutralize the influenza in immunocompetent person. The neuraminidase is 9 types, and among them 1 and 2 are important for human disease. Neuraminidase is important for cleaving of the virus and release. It cleaves the neuraminidase and causes release of the virus from the host cell. It also degrades the mucus of the host cell respiratory tract, and thus it induces the virulence factor of the virus. So here we can see that neuraminidase is important at the last stage, and that is during the release of the virus, progeny virus, and hemagglutinin is important during the first stage, that is the binding of the virus with the host cell receptor, that is neuraminic acid receptor and sialic acid receptor. So there is an important term, that is antigenic shift and antigenic drift. Antigenic shift is for the reassortment of the segments of the RNA genome, and antigenic drift is the mutation in the RNA genome. So as for example, the influenza virus has segmented single-stranded RNA genome. So if this is a segment, so if these segments are reassorted, this goes there and this goes here, then there will be the total change in the genome, and a new viral strain will be induced. So this is antigenic shift, and this is the reason of pandemic attacks. And antigenic drift is the minor changes and shift is the major changes. Drift is minor changes which result from the mutation. Like here a mutation occurred and some change may occur. This is the drift. This is for yearly epidemics. So we have told that it is an envelope virus and envelope contains glycoprotein spike, one glycoprotein spike hemagglutinin, another glycoprotein spike neuraminidase. As it is envelope virus, so there is a tegument between the nucleocapsid, this is helical nucleocapsid, and the envelope. This contains the matrix protein. The matrix protein are two types, that is matrix protein M1 and M2. The M2 protein is important for because it provides an ion channel. The ion channel communicates between the interior of the virus and the exterior milieu. This ion channel is important for uncoating of the virus. Through this ion channel, proton enters and proton is transported. So the envelope is disrupted and uncoating of the virion occurs. So it is important for its virulence. The influenza virus is categorized according to group antigen, group specific antigen, and type specific antigen. I have already told you group specific antigen is due to the internal ribonucleoprotein in the nucleocapsid, which causes it into three groups A, B, and C. The type specific antigen is on the surface of the surface glycoprotein, that is hemagglutinin and neuraminidase. Their combination result in different types, antigenic types. Here we should remember one thing, that antibody against neuraminidase does not produce neutralizing antibody, rather it reduces the release of progeny virus and therefore reduces the reduces the spread of the virus to adjacent host cells. There is another important virulence factor of influenza virus, that is NS1 protein. This is non-structural protein 1. This non-structural protein 1 inhibits the interferon mRNA of host cell. Therefore, innate defense, that is interferon is our innate immune defense, this is reduced due to NS1 protein. One example of reassortment can be seen that I have already told you that influenza virus type A causes disease both in animal and in human. So, this is avian influenza virus containing the segmented RNA like 8 segments. Because segmented RNA have 8 segments. The genome RNA has 8 segments, and human, here we can 1, 2, 3, 4, 5, 6, 7, 8. So 8 segments. So if a farmer who deals with birds, chickens, got infected by his lung cell, same lung cell got infected by avian influenza, and he is as human, so he got attacked by human influenza type A. Then there will be a reassortment as it has segmented RNA genome. So reassortment will show that there are 7 segments of human RNA and 1 segment of avian RNA. So it is a new strain. In this way, antigenic shift occurs in case of influenza virus. So up to now, we have discussed about the structure of influenza virus, which has single-stranded RNA genome of negative polarity and segmented RNA. You have to remember that it contains 8 segments, but this produces 10 mRNA, 10 protein. 10 protein. Although 8 segments of RNA, but 10 proteins. Among them, 8 are structural protein and 2 are non-structural protein. And it has envelope and a helical nucleocapsid. This is the structure. And we have told about the virulence factor. The virulence factor is hemagglutinin, which acts as receptor, which binds with the receptor. Then neuraminidase, which cleaves the neuraminic acid and causes release of the virus. Then matrix protein M1 and M2. M2 is ion channel and is important for uncoating of the virus. And the NS1 protein, which inhibit the interferon of host cell. So now come to the replication of influenza virus. It the source of infection is airborne respiratory droplet. So airborne respiratory droplet, it enters through the nasal route and then binds with the host cell mucosa sialic acid receptor. The hemagglutinin binds with the sialic acid receptor on the host cell. Actually, this hemagglutinin is cleaved by extracellular protease and is protease of host cell and is formed into a modified hemagglutinin. This modified hemagglutinin actually binds with the sialic acid receptor of host cell. After the binding, the uncoating occurs. The uncoating is favored by low pH and M2 protein. M2 protein causes the ion channel and proton transports and disrupts the envelope, thus encoding of the virus occurs. So after the uncoating, the nucleocapsid enters the cytoplasm and then it migrates to the nucleus. There the genome RNA is transcribed. So I have already told you that the influenza virus contains an RNA dependent RNA polymerase. This RNA dependent RNA polymerase causes genome RNA to transcribe. 8 mRNA in nucleus is formed. So the genome RNA has 8 segments. The genome RNA has 8 segments, and these 8 segments, with the help of RNA polymerase enzyme, this genome RNA negative polarity is transcribed into 8 mRNA. 8 mRNA, that is the positive polarity. So 8 mRNA. This occurs in the nucleus because a methylated guanosine cap is required, and the cap is obtained from cellular nuclear RNA by the process of cap snatching. After that, 8 mRNA are formed within the nucleus. Then some mRNA goes to cytoplasm and translated to protein, that is the translated into protein, the NP protein and M protein. I have said that some mRNA goes to cytoplasm and translated into protein, and some RNA remains within the nucleus. And viral mRNA within the nucleus acts as template for the synthesis of negative RNA genome. And here a different RNA polymerase enzyme is used. So this was a positive strand mRNA which is now transcribed to negative strand RNA, and this negative strand RNA is the genome RNA. Here a RNA polymerase enzyme acts, but this RNA polymerase enzyme and the enzyme previously used here are not the same, they are different. After that the RNA genome in the nucleus and the complex is transported to the cytoplasm. The helical nucleocapsid assembles and then by budding process they exit from the host cell and got their envelope from the host cell membrane. Now come to the pathogenesis. The virus infects the mucosa of the upper respiratory tract and lower respiratory tract. In the upper respiratory tract, it may infect the mucosa of the larynx. It may infect the mucosa of the nose and pharynx, and in case of lower respiratory tract, it may infect the mucosa of larynx, trachea, bronchi. If pneumonia may occur, then it will infect the alveoli. Severe myalgia may also occur due to influenza infection, and this is due to the release of cytokines. The cytokines causes severe myalgia. Now come to the clinical feature. The virus's incubation period of 24 to 48 days, and it resolves within 4 to 7 days spontaneously. The clinical feature include fever, myalgia, headache, sore throat, cough. Ray's syndrome may occur if after influenza B virus infection and patients, mainly children, treated with aspirin. The Ray's syndrome include encephalopathy and liver degeneration. There are some complications of influenza, mainly pneumonia. The pneumonia may be due to primary influenza viral infection or may be due to secondary bacterial infection. And another complication is Ray's syndrome, which includes encephalopathy and liver degeneration in children with influenza type B infection who are treated with aspirin. Myocarditis may be a complication, and death occurs in 0.5 to 1 per 1,000 cases. The pneumonia, if pneumonia may occur, there should be some factors. An immunocompetent person will not have pneumonia. The persons who may be infected who may be infected with influenza virus and get pneumonia includes the factors that are elderly, debilitated patient, pregnancy, mucociliary dysfunction, phagocytic cell dysfunction, alveolar exudates provide rich growth medium for bacteria. Now come to lab diagnosis. Mainly it's clinical diagnosis, and lab diagnosis include isolation of the virus, serology, viral antigen, viral RNA. So isolation of the virus, here sample should be nasal washing, throat swab. Sample should be obtained 3 days after the onset of infection. Then it should be cultured in embryonated egg or primary monkey kidney shell vial culture and detected by heme adsorption or heme agglutination inhibition test. Serology includes significant rise in influenza IgG by serological assay, heme agglutination inhibition, and ELISA. Viral antigen, direct antigen testing for type A virus, fluorescence microscopy, and viral RNA by RT-PCR, that is reverse transcriptase PCR. Treatment is oseltamivir and zanamivir, which are oral, and IV peramivir. These are mainly neuraminidase inhibitor, so they inhibit the release of the virus. Now amantadine is another drug. It can be used for treatment. It mainly blocks the M2 ion channel. Amantadine is used only in type A influenza infection, but as resistant to amantadine has already been invented. Prevention, we can prevent influenza virus by giving vaccine. There are two vaccines, killed vaccine and live attenuated vaccine. Other measures are using hand gloves or mask, washing your hands frequently, etc. The killed vaccine and live attenuated vaccine have a side effect, that is, they can cause Guillain-Barré syndrome, which is the ascending paralysis. Influenza vaccine, the killed vaccine and live attenuated vaccine both are trivalent. The trivalent contains 2 type A and 1 type B, the strains of previous winter outbreaks. The protection efficacy is 70%, protection duration is 1 to 3 years. The vaccine may contain whole inactive virus or subvariant or surface antigen. The inactivated vaccine or killed vaccine is given IM and live attenuated vaccine is given intranasal. Prevention is recommended for target population are elderly over 65 years, children between 6 to 59 months, history of chronic heart disease, chronic liver disease including asthma, diabetes mellitus, resident of nursing home, healthcare personnel. Contraindication egg allergy, Guillain-Barré syndrome, acute febrile illness. Live attenuated vaccine is administered nasally, given to children in 2 doses of 1 month apart. Concomitant neuraminidase inhibitor should be avoided, less effective than inactivated vaccine. Contraindication of vaccine is pregnancy and egg allergy. Now we will discuss about the other respiratory virus. Paramyxovirus, that includes parainfluenza virus. Parainfluenza virus Parainfluenza virus has only heme agglutinin, but it does not have neuraminidase and fusion protein. The respiratory syncytial virus, it has only fusion protein. These viruses have non-segmented single-stranded RNA genome of negative polarity. They have helical symmetry. They causes respiratory tract infection and pneumonia, bronchitis, bronchiolitis. The coronavirus family includes single-stranded RNA genome of positive polarity. The endoplasmic reticulum gives the envelope of the coronavirus. The coronavirus includes SARS coronavirus, that is severe acute respiratory syndrome virus, and MERS coronavirus, Middle East respiratory syndrome virus, and the recent one is COVID-19, that is coronavirus disease 2019. So COVID-19, the SARS coronavirus caused the epidemics during 2002 and the MERS coronavirus during 2012, and the novel coronavirus, the COVID-19, it caused pandemic in 2019 and 20. These are all about respiratory virus.